Hi, I'm Dr. Susan Butler-Wu. I'm the director of the Clinical Microbiology Lab here at LAC+USC. I'm a clinical microbiologist, so my job is to oversee the Clinical Microbiology Lab here to make sure that the tests that we offer are the most appropriate, best tests for our physicians' needs, to help make sure that we're compliant with all the regulatory components that go into lab testing. And then also an important part of my job is to be there to help physicians interpret tests. At the beginning, we didn't really fully understand this virus. There was a lot of misinformation out there, and there certainly was a tremendous amount of fear. Am I going to be safe doing this testing and doing my job? The challenges were relentless. The initial challenges that we faced was an inability to obtain swabs, the swabs that are used for testing. At the time, the swabs that were available were made in Italy, and Italy was under lockdown. Unfortunately, at the government level, swabs, when they became available, were being prioritized to large reference labs, so it meant that we were only getting around 10% of what we would order. So initial problem with swabs, initial problem with tests at the beginning of the pandemic. There were no tests available that could be run in clinical labs. One of the things, especially as we're surging right now, our department, our clinical microbiology lab here, our clinical laboratory scientists and staff are doing so much more testing than we'd ever done for anything previously. The testing that we do is extremely manual. It involves manual pipetting. So our team, our staff, our manager, Kate Chang, our supervisor, Rose Dos Angeles, and one of our really super techs, David Quintero, have really worked really hard to make sure that we have the tests available, to make sure they're validated. But one of the things that we worry about is potential staff burnout, as in all clinical departments in the hospital. It's just a relentless burden of testing that is ever increasing, and it's entirely dependent on humans to be running those tests. So every one of those tests, there's a person that did 2 pipetting steps to generate those results. Our staff are really doing a ton of heavy lifting, and just with the surge right now, the percentage of positives that we have are really high. So our staff are handling many positive patient samples a day. So they are what I like to refer to as the hidden front line, the people behind the scenes that are basically making those diagnoses that people don't see. Now's the time to really double down and wear your masks and distance. And I know it's hard, but if we don't all band together and take these steps and make these sacrifices, there's going to be many more unnecessary deaths. The hospitals are really a breaking point, and so we just need everybody to do their part to make that individual sacrifice to do the right thing and help our healthcare providers and folks that work here at LAC+USC. It's hard, we can see the finish line, but if we don't double down and really adhere to those things, it's going to be a lot worse. So just to stay strong and dig in and do the right thing.